I always thought it was just depression. That's one of the most common things I hear in clinic. And I always say the same thing. You are 100% right. It was. But here is what most people don't know. Depression isn't one thing. There is major depressive disorder, there is dysthymia, which is a chronic low-grade depression that has been running so long, people think it's just their personality. There is depression that is secondary to OCD, which we treat very differently. And then there is bipolar depression, which looks almost identical on the surface, but responds to treatment in a completely different way. If you take the same approach to bipolar depression that you would take to major depression, you can make things significantly worse, not by accident, just by not having the full picture first. I'm Ibrahim, nurse practitioner and registered psychotherapist, and what I want to explain today is why having the full picture before treatment starts isn't just thorough. It's the difference between getting better and going in circles. Here is the specific clinical situation I see regularly and why it matters. Someone comes in, they have been depressed, they have been treated for depression. Maybe it's helped somewhat, but there is something underneath that hasn't resolved. When I take a careful history, I start to find patterns that don't fit pure depression. Periods where they needed less sleep but felt fine, actually felt great. Decisions that felt brilliant at the time that they later couldn't account for. A speed to their thinking that came and went. Moods that shifted faster than the circumstances explained. This is what I'm looking for, because if that pattern is there, even subtly, and I start treatment with an SSRI or a stimulant before addressing it, I could trigger a manic episode. Not might, could. And for someone who has never experienced that before, it's destabilizing in a way that takes a long time to recover. So what do I do instead? I stabilize the mood first, always. If there is any indication of a bipolar spectrum component, that is the priority. I will start with lamotrigine, a mood stabilizer that's particularly well suited for people whose presentation is more depressive than manic. And I explain it this way: we are not treating your depression by suppressing it. We're making your mood more even, more predictable, so that the floor doesn't shift, so that you have stability as the foundation before we do anything else. Clients often say, I just thought it was depression. Why not we just treat the depression? All right, I say, you are right, it is depression. Bipolar disorder has depressive states, often more pronounced than the elevated ones. But the path through it is different. And now that we know, we can take the right path. What clients often tell me, when this lands correctly, is something I never get tired of hearing. They leave the appointment sad and happy at the same time. There is grief for the years of not knowing, for the treatments that didn't fit. And underneath it, relief, because the formulation finally makes sense of things that never made sense before. And I tell them, what made you who you are is not the medical label. You are a brilliant person. Your strength, your resilience, the way you have managed this without any of the right tools, that is still you. We're just going to give your nervous system some stability. And imagine what becomes possible when your mood is more predictable, when the floor is not shifting anymore. This is where the integrated model changes everything. when assessment and treatment happen with the same clinician. I'm not prescribing based on a referral or a report someone else wrote. I built the clinical picture. I know what was borderline. I know what the differential looked like before the final formulation. So when I'm making a prescribing decision, I have complete context, not just the diagnosis, but everything underneath it. That's what integrated care actually means in practice. Now, let me talk about the family piece because this comes up constantly. Sometimes the client isn't the one who is initiating this process. The family does. A parent, a spouse, a sibling, they come in and they are scared. And their instinct is to go in strong, to say, your thinking isn't right, this isn't reality, you need to change. But I have to be honest with them. If you go in that way, you will lose. Whatever that person is experiencing is his reality. It's not accurate to ours, but to him, it's just as real as anything we're seeing. You push against that directly, you push him away. So I changed the approach with the family. Don't lead with the diagnosis. Don't lead with what needs to change. Lead with his strength. Find what he actually wants. And often it's something completely reasonable. Wanting to work, wanting to feel better. Use that. Let my team build a relationship with him first. Skepticism is normal at the start, but when I can sit with a family and map what the last 10 years actually looked like, the patterns, the moments, the things everyone noticed but nobody could name it, the room changes. They trust me. And that's when the real work begins. The post-assessment path at Crocus Care is built around one idea. We don't hand you a report and send you out the door. Assessment is the beginning. After that, medication management when it's indicated, titrated carefully over time, adjusted based on real response, not just a standard protocol. Therapy through our registered psychotherapist, psychoeducation for families, and for clients whose condition has materially affected their functioning and their finances, we assess for disability tax credit eligibility because that support exists. But most people don't know about it. And it can make a real difference for people who have been managing without any of the right supports for years. If you have been in treatment and something keeps not quite fitting, that feeling is worth paying attention to. You might be right. You might have the wrong picture. And getting the right picture before the next round of treatment could be what changes everything. crocuscare.ca. Complete the intake form. We will take it from there.